So people with narcissistic personality disorder have a very hard time admitting that there is something wrong, right? If they do seek treatment, it might be for like symptoms of depression, or if they're like self-medicating with drug or alcohol, or some other mental health problem, or because it's more prevalent in males. Oh, like my wife made me calm because she says we have to work on our communication. I've heard that many a time, as you can tell. So it is kind of difficult to know exactly what the prevalence of narcissistic personality disorder is in the general community and general population, because they typically don't seek treatment. People with personality disorders in general typically don't seek treatment. So we kind of have like the best guess of how prevalent it is, but that's nowhere near like a comprehensive, very accurate number. So it might be very difficult for them also to stick with treatment, because they might see any feedback from their therapist or psychiatrist or whoever they're seeking treatment from as an insult to their self-esteem. So, maybe that's something that you would want to think about a little bit more, or something that, you would want to work on a little bit. That can be like, oh my God, you're saying that there's something wrong with me. There's nothing wrong with me. So it can be very, very, very difficult for them to engage in treatment. And as such, they are less likely to improve or get better. So if you are somebody seeing this who thinks, ooh, like a lot of that kind of resonating with me, I might have narcissistic personality disorder, it doesn't mean that like all hope is lost, right? Like if that resonates with you, like there's hope that you can go and seek treatment. DBT, dialectical behavioral therapy, I think that stands for, is usually really good with treating personality disorders. So I definitely encourage you to reach out to a specialist. Look on the back of your insurance card. You can look up Psychology Today, headway.co, alma.com, I think. Those are all like places where you can find, I think, Grow Therapy also. It's kind of like this hub where you can sort through therapists. So you can find somebody who specializes in DBT or personality disorders, and that would be a great place to start. If you happen to be somebody in a relationship with somebody who has narcissistic personality disorder, if it's like a romantic relationship that you can leave, might be worth considering, especially if they're not open to the idea of getting treatment. Like I said, the likelihood of that is pretty slim. Not impossible, but pretty slim. So I think that's going to wrap up our narcissistic abuse / narcissistic personality disorder series. If you have any questions, drop them in